I was looking forward to it.
Yeah, I think it's fun.
Yeah. So.
The city must plan to come. Yeah, through our budget cycle, budget year, so 2 weeks and fun, but fun. So still in our budget promising. So much time.
Hey Beth, can I ask you a question about it? I just wonder
About-
anybody that has such on fun. I was great at this. I don't know, so it's, you know what, got this from, Robinalt, Matt Robinalt. I'm just curious. This is a couple weeks old, but we have these two, homes missing. And this one is looking like it's approved, this one is.
Right, yeah, so the green ones that are in recommended for funding and it's managed budget for what's good and not recommended for funding. So in a way, these got split up, so this one, line 12, includes all of our core foundational stuff, plus a small portion, yes, 270,000 for 20% changes. Resource navigation. The other 230 that we cut, it's just maybe that.
So this is tab, but some of these types of things.
It'll be a part of it just doesn't have it, because it all.
I asked for a new one because I had just found full and made some updates.
Okay.
So yeah, so
Thank you.
But similar to what you had
I did that before we're done today.
COVID funding last year. Yeah,
We all, alright, just checking.
okay.
Yes, it's the correct one. So it's actually less.
Okay. Okay. Alright, yeah.
So.
Well, no, no.
Yeah, thank you.
Okay.
Yeah, so cool, scary.
It would be helpful, in kind of advocating for that. Just those two, yes. Yep.
You know, we have all these things.
Yeah.
Impact us. Getting less, it's not. Yeah.
Okay.
Yes, something, I'm always helpful.
Yeah.
People, I don't think. Sometimes understand themselves. allow their voice to go for multiple.
Yeah.
But pay attention to it.
All right, well, thanks for answering.
You're welcome.
I use a commentary.
Breathe.
It was a process, but I learned a lot that series of weeks.
Yeah. Well, I mean, I was like, I feel the
Yes.
but I think let's make sure.
Yeah.
Yeah.
Thank you.
I like this space.
Great, good, how are you? Good. Cindy planning. On
It's kind of like.
2000. Or something like that. And so I hear that she's still around, you know, I mean, good work, but.
I
didn't know if you had talked to her about this.
Yeah.
Oh. Nice. Thank you. Nice color. Thank you. Like, really good idea.
I know, it's good.
I like now.
Every time.
For me, girls.
It's hard.
Wow.
Right.
No. Hey, Chris, how are you? You look great today, the hair.
Oh.
Very nice.
I need something to make the hair style or something.
No, you look wonderful.
Or cut it on.
You guys are good. A little wilted today, it's been a busy day.
You're always busy.
That's a good thing. It's good for me to get me.
Oh, I'm doing something. Yeah, you guys are.
Everything okay?
Too, but I actually.
I know it's been about.
I'll never hear from you again. What? Same old.
Well, it really doesn't change very much.
It's 11 years left. For my nephew, the other nephew was killed in a car accident. The same, so one was killed in a car accident on the right side. Next file, so the one was in, it was like right after. Her friend. She loved me too.
That's great.
So, yeah. I know all of you.
Well.
Cool. Yeah.
A rock, yeah. No, he's actually a little shorter. Taller than me.
Well, there will be reasons why that all the things because you got things.
They're all sharing out.
Yes, yeah.
Watch it. All day and eating. more, the everything leaders and understanding. Wednesday's my one day back.
Oh, good.
I'm just that process today, so. It's all good. Well, we're driving, that's a.
Yeah.
But if you've got to at the bottom, it's the other separate tabs.
Oh, fantastic.
Yeah, so you will be on top of each other.
That's really.
Where you go?
Yeah, that's a great idea.
Well,
Okay, it'll help you.
You told me about
Oh, okay, yeah.
let's see, the list before the principal day long.
Okay.
If you don't mind, I don't know, I don't mind.
Yeah, it's not quite time. Point time.
Yeah, all right. Good afternoon, everyone. It's September 26th at 2 p.m. Let's call to order the Regional Opioid Abatement Council Region 2 meeting. So I'll call it to order. I'm Tom Gonzalez. I am the Public Health Director and representing the Board of Health. Let's see, we have a quorum today. We have Trustee Younglin's on and Councilperson Black. Is Brian Mason on?
Oh, there you
Yes, I'm here, Chair.
Oh, great. Trustee Mason, great. Looks like we have our group here today. That's awesome. We'll move right to number 2. Any public comment? Not seeing or hearing any, we will close public comment and move to item number 3, which is approval of the August 22nd meeting minutes.
Chair, I move that we approve the minutes for August 22nd, 2024 as written and presented.
I'll second.
We have a motion and second. Any further conversation? Hearing, seeing none. All those that oppose the motion.
Sorry, I'm opposed to everything.
Hearing none, that passes unanimously. Thank you. Now we'll move on to item number 4. That's the 6-month report on year 2 funding. If you recall, council members, every 6 months with the first 6 months of the year contract, we get an update from our grantees, awardees. We have 2 this month, and you'll see there's an action required because the infinite wisdom of this council was we only front the first 6 months of the award until we get this update. Then from there, if we decide everything's going well, we then approve the next 6 months. So that's what the action item is up for. So we'll start off with the Colorado Health Bank.
Hey everybody, my name is Izzy Pike. I use the pronoun she, her, and I'm the Associate Director of Prevention Services here at Colorado Health Network. I just want to take a moment to thank the council for having me here to present on this work. We're so incredibly passionate about what we can do, and we're grateful for the continued funding and support of this council. Next slide, please. So this is just going over the brief objectives. I won't name them off one by one. I would like to say that this is only half of the numbers that our staff have completed in the last 6 months, just because this is what the grant is able to support. So in theory, you double these numbers and that's really what you're getting from this money. And our staff have been really incredible in making sure that we're getting out in the community. A large part of this was expansion of services. We have expanded out into Loveland as of July of 23. And so a lot of this was based out of Loveland and making sure that people were seen. 266 visits there. And really, that came out of a demand of hearing from people in the community and hearing from participants that we were serving, that we were needed there. So we are there every Tuesday morning from 9 until 11:30. So in just 2.5 hours, we're making sure that services are accessible in Loveland and the next part of Larimer County. Next slide, please. For Lincoln Vista Care, a lot of our program is really based off of referral. We recognize that syringe access and harm reduction services are an entry point for folks. So, you know, we really we act as that starting point where it's non-judgmental. We don't know people's names. They're coming in maybe just for a syringe that day. And then how does that develop over time? So we really have really stellar conversations with folks about how we can have a safer, healthier them today for a safer and healthier community tomorrow and today. We have a lot of behavioral health referrals and a lot of interest in behavioral health referrals, as well as 58 medication-assisted treatment for referrals, with 19 new intakes during this time since February forward. And that's an in-house service that we're happy to provide in partnership with FMC on Wednesday nights. Another part of the expansion part of this grant was expanding testing services. Previously, our testing services were very limited to only 4 hours a week. Our team has since opened that up to 20 hours a week. So anytime that we have syringe services available, our testing services are also available. And we've really seen a significant jump in numbers. That used to be our annual numbers, and that's half of what we're reporting in the last 6 months. So we're seeing lots of folks care about their health, care about their well-being, care about the folks and the people that they're using with, having sex with, and really engaged in the public health aspect of that. So we're really thrilled to be able to offer those services. Here's some accomplishments. The first time that we presented to you, we had just started using our internal system Helix, which is great to have an internal system. And we were like flying the plane as we were going, and or building the plane as we were flying. It was very scary and we weren't capturing everything adequately. So I'm really excited to report improved numbers to you this time that we're talking with you. We are well over the 50% mark for most of our objectives, as we listed out in our 6 month, in our scope of work. Lots of community engagement. We've been doing stakeholder engagement every morning, day and night that we've been doing services. All of the networking, we've had 2 open houses and really just making sure that people know what we're doing. We've had a lot of turnover, unfortunately, just kind of happens with the seasons of the time. And we've maintained excellent services and actually have maintained the expansion of those services throughout that time as well. As I mentioned earlier, we've increased testing options. I do think it's also worth noting that while these accomplishments on the large end are really cool, the smaller accomplishments that we see on a day-to-day basis with our participants really go a long way. In our 6 month report, we have information about the smoking kits that we distributed, as well as syringes and everything else we provided. We're seeing people transition from injection use to snorting and smoking because they're provided with different options. And really that's reducing transmission of hepatitis C, reducing transmission of HIV, and really just making sure that we're giving people options so they can have a healthier them today. So thank you very much for having me. And I would love to answer any questions that you may have.
Questions?
I'm just curious, because I don't know. In Loveland, do you go to the LCC or where are you?
We're at Salvation Army on Tuesday mornings. Yes.
Thank you.
Mm-hmm.
Hi, Izzy.
Hi.
Thank you for this and all the work you do.
I have a question, Lizzie.
Are
Izzy.
there,
Councilman Black, sorry, Shane's asking a question.
Oh, I couldn't hear. Apologies, Shane.
Can you guys hear online, or do we need to be louder?
Maybe a
I can hear you guys.
louder.
Yeah, and raise your hand so we make sure we don't miss you online. That'd be great.
She's in Paonia.
Mm-hmm.
No, somewhere like that, Pagosa. Anyway. So I know that most of your clients come through referral.
Mm-hmm.
And I understand the prudence of not advertising presence too loudly.
Yeah.
for obvious reasons. Have you guys considered any kind of a public information campaign, or formal way to inform communities about the obvious benefits of the work you do and dispel misinformation and fears?
That's a great question. No, we have not. We have not considered it on a larger end. It's definitely something I can bring up to our executive team.
Want to?
I think that we ought to. I think that there's so much success that can happen in this work, and that there's also, like you said, a lot of fear and stigma that can be tied to it as well. And so, you know, in the last, 3 months, I've really had the opportunity to get loud and proud in Loveland. And I see the benefit to that. And so it's definitely not something that we would shy away from.
Counselor Black, yes, please.
Thank you, Mr. Chair. It's good to see you, Izzy, and you have been doing a lot of work in Loveland, and it is making a difference. So, but I totally agree with Shane. Kind of a strategic plan to get the narrative where it needs to be, a safe narrative. So that would be great. I do have a question on your slides, and I think it's on page 12, and it's regarding the safe syringe program and the drop rate of 53% returned. Is that typical, Izzy, for these programs?
No, it is not typical. That's actually significantly lower, and we did
Okay.
try to note that. We're typically hovering around 75 to 80% for our return rate. That being said, with new staff, they look at a sharps container and they don't necessarily know how to calculate what is in that. And so we're actually probably underreported very significantly. We're also discussing other options for disposal and opportunities. So we have, in this last 6 months, we've actually launched 4 more sharps containers in the community that are public that we monitor and dispose of. So then it's just increasing additional access points throughout Larimer County for disposal.
Okay, thank you. Perfect. And then on page 14 on that slide, and you did reference your referrals to different community partners. Do you guys have any requests, or do you do any referrals regarding housing, Izzy?
That's a great question. Housing is really difficult for us to navigate, Councilor Black. And so it's something that we very loosely track as far as, like, you know, we're able to refer over to the Murphy Center or to neighbor for certain assistance. However, because it's so hard to get people into that, it's also not something that we're able to really talk about at length to count as a referral.
Gotcha. Well, I appreciate the presentation. Thank you so much for all your work.
Thank you. Trustee Youngland. You're on mute, Trustee Youngland.
Sorry about that. It's been a while since I've had to Zoom. And I appreciate that opportunity when I can't make it down the hill. Thank you for the presentation and the detailed slides that followed. I did see that you referenced not only in the slides, but also just commented on the shortage of staff and the turnover. And so that reflected in your numbers. I just would like to know kind of your thoughts and the group of what you're doing to hopefully remedy that and to sustain your staff, because I mean that is, everybody is seeing that, but we need to figure out how to curb that so the numbers can be where you projected.
Absolutely. Thank you, Trustee Youngland. So we actually, I don't want to spoil too much for what we're going to be discussing within our proposal, but we have launched several leadership, professional development and wellness initiatives across the state in our other other 5 locations. And we've actually seen some really significant improvement as far as staff retention, professional development, commitment to being here. And then as well as participant engagement as well. Like when we have healthy staff serving for our participants, we have healthier participants. And so it's definitely something that's very much so at the forefront of our mind and that we're definitely planning for to ensure that we can have a sustainable workforce.
Okay, thank you for that. And then also, you know, I know Estes Park is quite a ways away from the great work that you're doing in Fort Collins and extending into Loveland. I would I always like to hear, what your thoughts are on how you can reach our community. And even if it's not physically being there, just as Shane referenced, getting the word out and the education piece in written form or what have you to reach locations like Estes that aren't maybe having physical locations yet.
Absolutely, thank you. So in Western Colorado and in Southern Colorado, we actually launched a mail order harm reduction program that we're particularly excited about. And we have been in talks with one of our second other funder, Summit Stone, to explore that for Estes specifically. And along with that would come the necessary stakeholder engagement to ensure that we're notifying the proper parties. And then I think that we would also aim to be up there monthly so we could offer our testing services as well. That being said, we do partner with Binksbox for testing services, so we can still do mail order testing kits as part of that. So it's definitely something that's on our radar and that we want to explore. We desperately would like to make it into the Estes community.
Yeah, I was excited to hear and thank you for mentioning that mail order bit. I was interested to read about that. Creative. I hadn't even thought about that. So thank you for your time today.
Thank you, Trustee Ellen.
Yes.
Thank you, Mr. Chair. Thank you for being here today and the great work. And it was great to have a tour of the day before comments location. So I get one for you. Yeah. So I have a couple of questions. The first one is on page 14 when you talk about participant zip codes, and you list several, and I was excited to see about Red Feather Lakes and Wellington, and then you list Carr and Windsor and Johnstown. And I'm not sure if Carr's in Larimer County or not, and
I see Gina very much so shaking her head. Yes, it is. Thank you, Gina.
parts of it, and parts of Johnstown and Windsor. So I'm wondering if those pieces are well, so when you're reporting those numbers, are you reporting numbers that are in Larimer County or just all of the?
All of our Larimer County numbers get reported strictly to you. As I mentioned in the report, we're seeing folks from Wyoming, Kansas, all sorts of places that are coming to access services. And those do not get reported to the Larimer County.
But the grant money that we have for our region goes to those people in Larimer County and those that
only to Larimer.
Okay. Yes. Yeah, I know parts of Carr, but in parts of Windsor and a very small sliver of Johnstown. So I'm just trying to, make sure.
Absolutely.
That, because that region also has healthy programs and funding too. So
yes, they do.
And they're partnering with us next week. Then I had a question about the other page, the referrals. This is also this page 14 too. The referrals to behavioral health. And that's great to see. That was 218 referrals. And that's part of this grant that was part of this grant to help give referrals to behavioral health. I see some classes and Mulberry Access but this is unfortunately not a funded program, so I'm sure this is part of this funding to help some of that. Is that?
No, unfortunately not. And again, not to spoil too much of what we would like to propose. So we saw great immense success with our Connect program when it was launched by our interns. However, we had like 3 hours of availability and we have 20 hours of services. And so the 218 referrals are unfortunately not reflective of the amount of people who were able to actively engage in services. And unfortunately, we don't always have behavioral health interns, so it's just not a sustainable program for us.
Okay, I agree. Thank you for that. I appreciate that. And then the last question I have, and I appreciate all the details and the pictures, it's great. And we talked about reduce and prevent overdose, the objectives. 41 reported lives saved. I'm just curious, how is that measured and how is that reported? That's a wonderful number. I'm just curious about that.
Yeah, so that's all based off of what our participants share with us. So I can guarantee you that number is much lower than what the work that our participants are doing. I apologize. We know that people who are using substances are in that community are the first responders. And so that is really just based off of when people ask for additional Narcan, and when we offer Narcan, we ask what happened with their last kit. And that's based off of what they're willing to self-disclose in that moment.
Oh, that's really helpful. I appreciate that. That's great information. Great numbers. I appreciate your work and thanks for being here today. Thank you.
Yes.
Just have a couple really quick questions. I don't want to miss what was requested as far as the final questions, as far as you were wondering if you could use funds between line items.
Yes.
I don't know if Carol was able to help us answer that, and then also whether you're able to roll over funds from year 2 into year 3. And I don't think that gets into your proposal. Just want to make sure you get those answers.
Thank you, I appreciate that.
Carol, did you hear the question?
No, I wasn't able to hear that.
Question, can you hear me now, Carol?
I can.
They're asking whether they can move funds between line items in their budget, and then also whether they can roll over any of their unused year 2 funds into their proposal for year 3.
Yeah, in the budget document, the 6-month budget report, there was a place to indicate where they wanted to move funds between line items. And I don't know if that happened or not. If you look at that report, does it show the items being moved?
It just says it's.
Yeah, so no, I'm so sorry. We only did the budget to actual. My accountant wasn't sure about what we were able to do. I can tell you confidently that we would want to adjust funding within our disposal line item. So again, to your question about the disposal number and it being 53%, we actually spent a lot more in our disposal efforts because we were receiving so many sharps back. And so we would need to increase that line item to ensure that we could safely dispose of biohazardous materials.
So under the terms of the grant agreement, monies can be moved between line items, but it does take approval of this group. So I don't know, perhaps you could do the budget to actual and show the line items that you'd like to move, and the group could approve it?
That answer.
But not the other question.
Yeah, that-
I don't think that's gonna be.
So that's the first question. It sounds like that could be a plan that can happen between now and our next meeting, maybe.
Thank you, absolutely.
Great. And then the next question was the question was whether they can use any unspent funds from year 2 to roll over into year 3.
That would be up to this group as well. We don't know yet if they will be a grantee in year 3. And if they are a grantee, then it would be up to this group as to whether they want those funds rolled forward. We did allow everyone to roll forward from year 1 to year 2.
So would that be potentially part of the proposal process, maybe?
Could be, yes. Right. Okay, council, thank you for that presentation. We do have an action required here for continued funding for the next 6 months. So do I have a motion
I'll
on
make
that?
that motion, sir.
There's a motion. Is there a second?
I'll second.
With the caveat that they're gonna come back at their meeting to adjust those line item changes. Is that correct?
That's what you want to make sure.
I would just like to add that they'll have to come back if they want to move those. That doesn't approve the line items, maybe they'll have to come back and present that so we can make that a separate.
Okay. Is that, you good with that, trustee?
Yes, that's
Okay,
good.
great. So we have the motion to approve next 6 month funding with caveat that Izzy will come back with some line item adjustments. All right, any further discussion? All those in favor of the motion?
Aye.
Aye. Anybody opposed? That passes unanimously. Thank you, Izzy.
Thank you all for your time. I appreciate it.
Good job. All right. Northern Colorado Health Alliance is next.
Mr. Chair,
Yeah.
I have a quick matter I want to bring up. I know this next line item isn't an action item. However, I have been in contact with the council's attorney, David, and I believe I may have a conflict with a grantee that's reporting. So I'm not sure if I should recuse myself or not, because it's not an action item, but they are presenting this grantee. So I don't know if we want to leave it up to the board vote on that.
Is that for our Northern Colorado Health Alliance?
No, it's for the next set, the Abundance Foundation.
Well, I think we could go here and then we can address that at that time if that's
Great.
okay.
Great, thank you.
All right. We are a little behind time, just saying that we do have a lot to go, not to put pressure on you, but we just need to be more.
The hot seat.
Speak here.
The hot seat. All right. All right, I will move as concisely but as detailed as possible. But thank you for having me here to give a 6-month overview of the work we've been able to go forward with in 2024. Really, we'll hit a summary of all of our objectives, progress in each of those areas, and some highlights in those areas with remaining objectives. So we really kind of had 4 grants smashed into one. And so that includes community education, care coordination and treatment and recovery support, provider education and evaluation. And so going to move you through those 4 areas in that order to try and keep this slick for everybody. So area 1, that community education, our goal is to increase community-wide stigma reduction regarding effective treatment, recovery support, education, events, learning sessions, social media campaigns. It really is a catch-all bucket of really working to increase education for the region, but also decrease stigma as a result. And so doing that through a series of objectives, 1 per area, and I'll have you move forward and I'll keep reading objectives while we move. So quick high-level summary. Objective 1, we did it, great. Objective 2, we did it, great. Objective 3, we're on target to complete. But in talking through what that actually means, next slide. Overdose Awareness Day is really tied into that objective 1. That is to pursue 3 Overdose Awareness Day events in Larimer County. Those took place in Loveland, Fort Collins, and Estes Park. There are cute pictures from each of those events. Each of these events included on-the-spot training and education on how to use harm reduction supplies, including fentanyl test strips, xylazine test strips, naloxone kits, all of that good stuff. In addition to community resources, treatment and recovery organizations, community-based orgs, really embracing that whole person health situation for every individual walking through. Overall distribution, we hit about 350 to 400 naloxone kits out of NCHA. What's tricky about that number is that we had a lot of providers distributing naloxone, and we didn't capture all of their numbers as part of this event. And so good news, bad news, more than 350, good news. Cool. An additional highlight and impact for the council in Loveland's event, the following day from Loveland, we actually heard back from someone that 5 of the kits that were distributed out of that Loveland event saved 3 lives at the Mishawaka that same weekend. And that's powerful. And we were tired waking up on Sunday. We had done 2 events already on Saturday, and that really brought us forward to move through Fort Collins. But really, overall, we know our community wants to be a part of this solution, wants to have the tools they need to be successful, and that every overdose is preventable. So that was objective 1. Again, I'm going to move as fast as makes sense, so please let me know if you have questions. Objective 2, provide community substance use support education and overdose prevention tools, including harm reduction and recovery coaching, overdose prevention education, and naloxone opioid antagonists to a minimum of 400 unique individuals. We knocked this out of the park, folks. Obviously there's a lot in this bucket, and I do think for our proposal for year 3, I'd like to adjust our goal, because we 6,000 here, 400 is the goal. I think we can set our objective a little higher. But ultimately, the community-based presentations, 10 different organizations or entities. Through those presentations, 153 individuals were trained. In addition to that, we have our reversal project, where we have our naloxone kiosks that are located throughout the region, in addition to naloxone vending machines in 2 locations in Larimer County. And those did distribute that 6,723 naloxone kits out of the kiosks. Very happy to report we just got one in Wellington, in alignment with the grocery store up there. And similarly, we have one in the Mishawaka, as a result of that long-term partnership now. Additionally, across all of our ways in which we engage folks in distribution, just under 10,000 kits in the first 9 months of the year, 8 months of the year. And so looking to see that continue to grow as we close out 2024. Stigma reduction. So this is a subcontract to the health district to engage that Changing Minds campaign, Bright Science of Addiction campaign for the goal of stigma reduction. In their progress report to us, they said we're on track to get this done. In this contract, they're really honing in on ensuring that language is updated, because as soon as we publish something, we gotta do it again, make sure we're at best practice. So to do so, they had to go out to bid, identify their vendor, and then start building again. And so with that, they've done those initial steps of doing the proper solicitation, contracting, and initial meetings, with the overall goals of ensuring that they meet a minimum of 2,000 individuals with the campaign materials. Okay, care coordination. We're in working group 2 now. We are hopeful to improve treatment access and recovery support for people with substance use disorders. That's the goal we have in mind. Doing so through best practices, including MAT, peer recovery support, individual and group, be it clinical or non-clinical, long-term treatment, etc. That's achieved through these 3 goals. Keep rolling. Again, high-level summary. 1, 2, we did the darn thing. Great. 3, we still have some work to do to execute that last objective. So objective 1, this is some of the high-level takeaways of those numbers. From the staff funded, we have 2 care coordinators and 1 peer recovery specialist with the funds from the Larimer County Opioid Abatement Council. 279 care plans were initiated across those 3 individuals. So a care plan, anytime somebody says, hey, I want help, we put a care plan down. We work with them to identify what is the whole picture that you want to achieve, what's the first thing you want to do about that, and how do I help you get there? From there, of those 279, 188 of those were unique. So what that means is sometimes people disappear, but then they come back. Or we started here and they have one kind of care plan because they were in the criminal justice system. Now they're in the community. And so the things you have access to and your goals might be different. So let's open a new care plan and refresh. Across these 188 individuals, 1,670 tasks were completed. So in each care plan, folks are again assessing that person's goals. And then for every goal that they identify, assign a task for those goals. So to that end of that 1,670, 622 of those tasks were check-ins and follow-ups and meetings with those individuals. Needs assessments, 113. Behavioral health navigation into residential treatment, intensive outpatient, withdrawal management, 90 of those tasks. Group support meetings, 78. Peer support meetings in the Larimer County Jail, 143 out of that total of 451. Court support, so we have staff that work alongside our court system. So then we are both in the jail system, in the community, and in the space in between for individuals. And court support looks like I'm going with you, so you're not sitting there by yourself. And we can chat about what happened today. Social determinants of health, we had 101 tasks completed. We are changing the way we're documenting this in our EHR, so I do believe that's underreported, but more to come. Here we go. Objective 2. All right, Increase awareness of available support and treatment options in Larimer County, minimum 200. So mutual aid support, these are all anonymous groups. And so the minimum number of people we hit was 48. Because what I ended up doing for our calculations here was say, okay, well, if there's 3 here and there's 5 here and there's 5, these are the same people the entire time of the grant. It's a minimum of 48. Now we know that we have a mix of folks throughout those spaces. And so that's the minimum unique. Maximum is far greater than that, obviously, but we keep them anonymous so people feel safe. We don't bill, so we don't need their name. Community substance use overdose prevention education. Again, that was the 10 presentations, 153 individuals trained. Printed material distribution, over 6,000, almost 7,000 materials were distributed. These are all in English and Spanish. And additionally, a really cool update from a separate grant. We were able to work with CDPHE and the BHA to get the lift the label overdose prevention naloxone materials translated into 5 additional languages. So we're pretty excited about that. We have all of those back from the company that designs them and have started distributing them. So if you need some, let me know. All right, objective 3, individual overdose prevention tools. I won't go too deep in here because we've kind of hit some of these numbers already, but again, those group coaching, jail-based coaching, community-based individual peer coaching, and individual overdose awareness and harm reduction. This number is for the individuals of that unique count. So that's why this number looks a little different than that community 153. Just to clarify there. All right, and rethinking addiction. It's next week, Tuesday. In case you did not know, that is one of the ways in which we're achieving the goal of increasing knowledge and awareness and best practices for providers who all work in this intersection and mix, because we know people hit all the systems and need all the systems to be on board with what's good, what's bad, what's in between. And so to that end, we have, can you scroll for me? Thank you. I'm used to having a clicker. So the Rethinking Addiction Conference is objective 2. We're not there yet because it's not Tuesday. Objective 1 is about peer recovery coach trainings. Successfully completed that. And here's a summary of that objective. We were supposed to train 20, we trained 32. To that end, had 2 in-person and 1 virtual to achieve that 32 count. With that, one of these was really unique in that we partnered with the Behavioral Health Pathways program at Poudre School District and trained some really young people. And it was cool. So following up with them to figure out how they want to move forward, if they want to do that again. It is a smaller group in that Behavioral Health Pathways program, so it was a smaller training, but I think given that it was a young group, it was probably good that way. We did in our carry forward request to the council at the close of 23, ask for additional use of those funds to do more trainings like this. And so we have 2 additional scheduled for 2024. Okay, so when I made this, we had over 500 and now we have 600. So this slide wrong. And we have 36 speakers now. So Tuesday, we'll get there. Tuesday. Evaluation. So by the end of Q1, developing, conducting implementations and outcomes evaluation methodology for stigma reduction, care coordination, provider education programs in progress. Yay. End of Q4, in collaboration with Larimer County Opioid Abatement Council grantees and other stakeholders, develop a cross-site program evaluation plan for all council grantees to measure consistent program outcomes in progress. By the end of Q3, implement the Larimer County EPI Outcomes Work Group, and that is modeled off of the state EPI Outcomes Work Group, and that is happening. Yeah. Just like that. Go. Go, go, go. So again, this is just that summary of the areas that are tied to that objective one evaluation area, and we've hit this one already because we talked about that. We're evaluating all of these pieces as part of our contract. Okay, and so for a quick spotlight on objective 2 and 3, this is the group that has formed is to really look at data through a multitude of lenses, and so working very closely with Jared and the Lambert County Health Department, and a few folks on the council, and several partners to really look at what's happening in the community, what data is available, and how do we actually leverage that. Objective 3, this is to build out a grantee evaluation structure, and so Butler has started that outreach. Jared has also supported with that outreach to get everybody engaged and started in that process. Okay, so that's a quick summary. 2 check marks. Yes, yes, no. Yes, yes, no. Yes, no. Almost there. Questions? I tried to talk really fast. Yeah.
Smart. No, I appreciate it because on 40 overall, I think that was really visually helpful. And I think that was a really great presentation. There was a lot of great information, and so I thank you for your work. And I do think the evaluation and work that we're doing on that subcommittee is it's gonna be pretty impactful. So appreciate it. And yeah, so it's not Tuesday, but Monday's gonna be great too.
Monday also gonna be great, and so Wednesday. Any other questions that I can answer?
Any other questions? Before we move to a motion, I do disclose every time is I serve on the board for the Northern Colorado Health Alliance, so I abstain from the voting here just because of that. Yeah, Trustee Youngland?
I just want to take a quick second, MJ, what a great presentation. Love the visuals, was able to track it very clearly, and what a great job. So I can't wait to see how this week turns out for everybody. Thank you.
Thank you, Cindy.
Yes.
And only just really quick, because I made a note, I was gonna bring it up, but you did a great job highlighting it. I just want to say again how great that example of the 5 kids that saved 3 lives the next day, just amazing. So it's very.
So if you're choosing yourself, should I run the vote?
No, I've asked David. I
Okay.
just don't know. So, thank you for that. Any further in a motion?
I make that motion to approve the 6-month report and continue funding.
Motion.
Aaron.
We've got a second. Any further conversation? All those in favor?
Aye.
Anybody opposed? And I abstain. Thank you for your presentation. Great job.
Thank
Good
you.
work. Okay, moving on. I'm gonna kind of outline what we're gonna do for agenda 5 or 5. We've got to really be tight with this. We have 8 presentations. As we discussed at our last meeting, these are folks that have received a grant from the rollout in previous years. They're going to come present, and it's based upon the graph we put, or the spreadsheet last meeting we voted on, and how much allocations for each one of those specific areas. So they have all received that. So that they'll each get 10 minutes. We're not going to ask any questions, unfortunately, because of time, but you do have a spreadsheet that Liv put together. Thank you, Liv, where you can put down questions, notes, comments, and then what are the full funding they're asking for. So we've got all that information. So you don't have to store that in your brain. Then next month, we have 5 presentations from community organizations that have reached out, that have asked that they have an opportunity to present. They have not received funding previously, but asked that they be part of that. So this is kind of a 2-part series. Today is ones that have received, and if they would like to go for year 3 funding. And then next month are those that have not been part of the grantee, but are asking for year 3 funding. Any questions with that? All right, we'll turn it over to Colorado State University Prevention Research Center and Nathan Ray. All right.
Hi, everybody. For those of you who I haven't met, I'm Nate Riggs. I'm the Executive Director of the CSU Prevention Research Center. We've been funded for the last 2 years to do some school-based prevention work with young people and professional development for teachers and educators who are implementing these evidence-based programs. It's a little bit tricky to talk about year 3 funding, given the schedules with schools and how we spent the summer planning for year 2 activities, and now we're just starting implementing year 2. But long story short is that year 3, we're proposing to have a combination of continuing to sustain the work that's working in these school districts, along with layering on additional prevention efforts for year 3. There we go. So I'll go over most of this in our 6-month review coming up probably in a couple months. But one of the things we won't be doing this year is we won't be creating new professional development content with these dollars. We have new funding streams that will take over that work. We'll continue to develop them out, but not with this 3rd year proposal. What we will be doing in this 3rd year is we'll continue to work with the school districts to track those educators who are engaging with the professional development and certifying them so that they can get these professional development credits and then ultimately be better, more effective implementers of school-based prevention efforts. So up to now, in about a year, we've trained 135 educators. Again, we'll talk more about that in our 6-month review. Created a number of courses, many more than we had proposed to. And then move on to the next one. We've done some in-person trainings as well that we'll continue to do for. Right. Okay, so this Blues program is an evidence-based mental health promotion and substance use prevention program. It's a 6-session, 6 to 8 youth cohort approach to promoting mental health and preventing substance misuse. Again, I'll talk about most of this in the 6-month review, but we're seeing really positive effects in the right direction, preventing depression, reducing depression, promoting coping skills. We've done a pretty basic cost benefit analysis. Since we're having such positive effects with this program, and since we're saving about $29,000 per cohort with this program, we're going to continue to implement that both in year 2 and in year 3 as well. At least that's going to be the proposal. Year 1 was about getting folks trained up to implement it and piloting it. Now, school districts they're implementing it district-wide. Thompson School District actually wanted to increase the number of high schools that are implementing this program. And so year 3, we're going to sustain it, and we're going to continue to support those educators in the implementation and evaluation of how well this program's going. So that's the first thing that all 3 school districts will be implementing for year 3. At least this is the proposal. Okay, so as you might remember, some of you were here and would hopefully remember, year 2 and year 3 are really about addressing district-specific concerns and district-specific priorities. So with Estes Park, they really wanted to address, really wanted to work with the Latinx families in the community. And so we worked with them to identify an evidence-based program that can be implemented for Latinx families. It's an evidence-based program called Guiding Good Choices, and it brings families and students, the caregivers and the students together in the schools. It's a 5-session program, evidence-based in reducing substance misuse and increasing and promoting mental health. So at the end of the year review for this year, the 2nd year, we'll have some data on how effective how well this program is working. And then so we'll continue that in year 3, and then add on and layer on some evidence-based social emotional learning programs that we'll identify with Estes Park to implement K through 12. So this is really skill building, positive youth development. So by the end of year 3, Estes Park will be implementing the Blues program, Guiding Good Choices, and the social emotional learning program of their choice. Pruder School District really wanted to focus on addressing the LGBTQI identifying students within that community, within their schools. In year 2, we are training, we're working with Rocky Mountain Equality for an in-person training for 14, it's going to be between 14 and 28 adult GSA, Gay Straight Alliance, Where is it? What is the word? Sponsors, it's right there. Sponsors. And so then this fall, they're working together to identify priorities and trainings that they would like to get at the end of this year. And one of the things that we've had a lot of trouble finding are evidence-based programs, substance use prevention and mental health promotion designed specifically for LGBTQI students. We have searched forever for it. We finally found one, and it's been evidence-based to promote mental health and reduce depression. It's called the Proud and Empowered Program, and we're really excited to start. The proposal is to implement that program in year 3. Then Thompson School District, they really wanted to focus on youth who had some sort of interaction, have been caught maybe once using substances, and they wanted to take a more restorative justice approach to preventing future use rather than suspending a student for using cannabis once or using alcohol once or getting caught with it once. Then they wanted to identify ways that, hey, how can we keep the kids in the school system, but still provide them some support? There's it's a personalized normative feedback approach to substance misuse that corrects these misperceptions of the amount of use and support for use. It is an evidence-based program. I've worked with the developers on the college version at CSU in cannabis use reduction, have found some really nice effects on that. So we worked with Thompson, and they're going to start implementing 3 versions of that in all 5 of their high schools, 1 for cannabis, 1 for nicotine, and 1 for alcohol. So the idea is that once a student comes in contact, they get in trouble for using a substance, then if it's cannabis, they'll do the cannabis one. If it's alcohol, then they'll do the alcohol. There's also other versions for non-substance use issues, but we decided that we have the budget to do all 3 of these across all 5 schools. And then in year 3, Thompson they've got a lot going on. And so we just started with this. So year 3, the proposal is to continue with the e-checkup to go, and then we'll layer on some other evidence-based programming to meet the needs, any emergent needs that start to pop up this year. So I think that was maybe even within 10 minutes.
It's great.
That was perfect proposal amount.
We were anticipating the 25% step down, so the proposal amount, we proposed 225.
225, thank you.
And that would include the programming and the technical support that we provide to the peers.
Thank you, Nathan.
Great.
Appreciate that. All right, moving right along, Claremore County Sheriff's Office. Sergeant Cook, welcome.
Thank you. Mr. Chair, more members of the council and guests, my name is Robert Tripp. I'm a sergeant with Claremore County Sheriff's Office. I currently supervise our co-responder unit and our school resource officer unit. So next slide. Our motto that we developed kind of, which really kind of captures what we try to do is to help, not harm. So our whole style of how we operate as a unit and how co-response works and the philosophy behind co-response is really to try to help people in the community that are struggling with mental health issues, substance use issues, or co-occurring issues. There's some photographs, some community engagement events. A couple weeks ago, last week actually, was National Co-Responder Recognition Week across the country. So we had a couple of proclamations thanks to the Board of Claremore County Commissioners and our board trustees down in Berthoud, who honored us with a community proclamation. Next slide. So I just want to kind of go over some of the things that we've done since we received the initial funding from ROAC. And our objectives were pretty simple. That was to add 3 positions to our unit, which basically helped us increase our availability to citizens in Larimer County. And what we intend to do with year 3 funding is to basically see that process continue. And basically it's a continuity of that expansion that occurred within the last year and a half due to the funding that we received from the ROAC Council. So since then, we've added a corporal position, Steve Fay is our corporal. We've added 2 deputies, Deputy Kevin Kingston and Deputy Eric Schultz. And we fully implemented a data collection tool and dashboards, which I think you guys have seen part of before. We'll talk more in depth about that later. Next slide. We were able to, along with our expansion, the other part of our partnership is really with Summit Stone Health Partners. In order for our co-response team to work and a co-responder program to work, we have to have the clinician. So I think all of you guys have probably heard of what co-response is and how we work, but basically we have a deputy that's partnered with a crisis clinician and they respond to crisis calls. So with that other funding, we were able to have one new clinician position for Summit Stone was added to our unit, and then also a clinician clinical supervisor. As I said, we increased by 2 additional teams. And another initiative outside of this, we also created the Youth Crisis Response Team, which works primarily in Thompson School District. And we're able to, with our 5 teams, cover 7 days per week and approximately 17 hours a day from 7 a.m. until midnight every day. We also added some additional collection data to our reporting tool and dashboard because we thought it was important to really try to dig down and capture some of the statistics related to substance use disorder. And one of the things I guess I wanted to delve a little bit into this a little bit more is that took a little time to develop that and put that into place. But I know like one of the council members, Mr. Ritter, he had a question about that at our last meeting. I wanted to kind of give you an idea that approximately 35 to 45% of the people that we actually contact, since we've adopted that data collection tool, now is showing that those people have either they've self-admitted that they've had either prior substance use or they're currently struggling with that, in addition to the other issues that we're trying to help them with. We've also had opportunities to share our knowledge and expertise at the National Association of School Resource Officers, the International Co-Responder Alliance, the Co-Responder Conference, the National Co-Responder Conference that's held every year, Philadelphia Joint Threat Assessment Training, National Association of School District Superintendents, and more locally, the Lakewood Co-Responder Symposium. We've got a bunch of other ones too that we've been able to really share our knowledge and expertise and really try to help develop this across both Colorado and the country. One other thing that this specifically I give a lot of credit to our corporal who was added as a result of this funding that we received, was we were able to completely overhaul Larimer County Sheriff's Office website mental health segment. I don't know if you guys have had an opportunity to look at that. I would highly encourage you to do that because we developed a pretty robust mental health list of resources and substance use list of resources that are available throughout the community. And we've had a lot of views from that, from citizens, not only in our community, in Larimer County, but also across the state and across the country. And I'll talk a little bit about that a little bit more later. We've also fully, I'm sorry, next slide, please. We've increased, as reported in our final report last year, for the first year funding, we increased the percentage of mental health substance use calls for service handled by the co-responder unit versus the rest of our patrol section, which was hovering between 28 and 30% prior to the grant funding to 53.1% after the grant funding by adding those additional teams and personnel. And really, I think all of us have talked about what our overall overarching goal is, and that is to save lives. And I think that's probably the most important thing we can do for our community members. I think it's something that sometimes we don't have a full accounting for, and it's hard to quantify. But I think that is our ultimate goal. And I think that because of our expansion and because of the funding that we received from Iraq, we've been able to contribute towards that goal. So for the year 3 funding, what we're requesting is the $210,000 the total cost of $433,472.04 to fully partially fund our 3 personnel that we've expanded as part of the original funding. And the whole idea behind that is to see that continuity of service continue. So that $210,000 will help us continue the things that we've incorporated and started and continue the great work that our teams are doing. Next slide. So some additional data points within the last year. Again, we've been able to increase capturing some of that data related to field contacts regarding current and former substance use. One other thing I wanted to point out is that only about 52% of all incident contacts resulted in any kind of holds. One of our goals with contacting people in crisis is that we try not to obviously take them to jail, but we also try not to flood the emergency rooms at the hospitals. And a part of this success, I think, also goes to Longview and the opening of Longview and our strong partnership with Longview to have a place for people to go when they are intoxicated and they're not able to care for themselves. We can bring them here. We've also had the opportunity to bring people who are struggling with mental health issues here to start that treatment process. One thing that we're pretty proud of, because it really is one of our primary objectives, is that only about 2.4% of all our contacts in the last year resulted in someone actually being arrested and taken to jail. And that's really what we try to do, is divert people from jail, from criminal prosecution for low-level crimes, and really help them help determine what their primary issues and concerns are. And when it comes to mental health or substance use, their primary concerns are just that, and we want to get them the help that they need. Jail is not the place for them. And it's also one of the most expensive ways of housing people in the community that are struggling. So we're pretty proud of the fact that a very small percentage of people that we contact actually are arrested and taken to jail. Some of that is accounted for by serious crimes. When somebody commits a serious crime, they still have to be accountable to the judicial system. And we still do our job to protect community safety, but for low-level crimes, that's really our objective. Talking about that website real quick, we've had approximately—
One more minute.
Okay, approximately 3,000 views from 353 cities across the country. Next slide. So really, this is our budget request, 210,000, which will help us fund at about the 48th percentile rate of all three positions, salary, benefits included. Next slide. And I just want to thank you again for the time and the opportunity to be here and talk about what our goals are for the year. It's the third year funding. So thank you very much.
Thank you. Appreciate that. All right, yeah. Follow how the hell that was.
Hi again. Izzy Pike, her Associate Director of Prevention Services at Colorado Health Network. Thank you so much for having us here today. I'm really excited to be able to chat with you all about the prospect of year 3 funding. With me today, I have Danny Willis.
Hello, everyone. I'm Danny Willis, and I'm our Director of Behavioral Health and Wellness at Colorado Health Network. I have my licensed addictions counselor, and I'm a licensed clinical social worker. Pleased to be here today.
All right, next slide, please. So when I heard 5 to 10 minutes, I went like real bare bones, and like we have, like, this is our big slide. So I'm sorry, we're just gonna talk to you. So one of the best things about funding Colorado Health Network is that you're funding harm reduction and treatment. And we know that treatment is harm reduction and harm reduction is treatment. And so we're able to cover every aspect of the substance use continuum. And so over here on the far right side, this is where we're going to be seeing some of that stuff from our year 1 and year 2 proposals, where we're talking about increasing access to the overdose prevention materials, access to safer use materials, reducing infectious disease transmissions, and linkages to care. That being said, as I mentioned in our 6-month report, our linkages to care, we were really kind of struggling to get people connected in the best way possible. A lot of the systems that we're working with are overburdened. They, a lot of circumstances have happened that have made them less available in the last year. And so we really want to work together. And we've seen a proven method across all of Colorado Health Network in different regions, where we can link together and make sure that we're partnering with a program called Connect and behavioral health to really make those linkages to care happen. So I'll pass it off to Danny.
Yeah, so our dream to expand the proposal would be to expand into the continuum, into treatment, into allowing access, filling gaps, and walking alongside our participants to move them wherever they'd like to go. So the intention for the treatment and recovery section you'll see would be to hire an integrated clinical care coordinator. So that'd be a behavioral health staff. The dream would be bilingual would be our intention. So we provide those services all around. We would want that funding to run our program called Connect. It's a program that we've been running in every building that we have around the state for Colorado Health Network. And we're looking forward to bringing it to Larimer County. So that program is a low barrier, high access intervention. It's a brief intervention model where the clinician is available as people come into services. So we have 20 hours of service hours in Fort Collins. People could walk in and access a behavioral clinician right on demand. They could sit and chat very simply. They could ask to enter into treatment. We could walk them right over to family medicine, or we could have a conversation, use motivational interviewing, evidence-based information and brief intervention, and provide them with the services that they're looking for. So really, we want it to be a clinician so we could meet them wherever they're at in that entry point and walk right over to our next level of care, which would be our Suboxone clinic that's in-house. So everything can happen on demand. And as Izzy shared earlier, we have piloted this program with our interns because we wanted to see how it would work. As we know, we had 218 referrals to behavioral health. We were able to capture 67 of those from January to May into the Connect program with our 3 hours a week at kind of that pilot program. Not enough. We want to do more. At our regions around the state, we do run Connect in other buildings, and we've served at the tier 1 level. We run it in a tier program. So again, someone could enter into just an encounter, just get to know you, build a little relationship, build some trust. So when you're ready to enter into the next level of care, you know who to go to. Those tiers, we have had around 1,200 interventions around the state, around the tier 2, which means we're actually moving into more of the therapy, the counseling. Maybe we're doing some coping skills. Maybe we're doing some referral to treatment. Maybe we're doing some assessments for substance use assessments and screening to see where we're at. We have 557 of those around the state. And then lastly, we had 220 around the state that came back and saw us multiple times to build that trusting relationship and to enter into the next level of care. So again, that Connect program is intentionally to fill the gap, provide trust, relationship, and an opportunity to move to the next level of care with someone.
And it's still low barrier, high access and anonymous, which is really cool. And it really kind of models the same service model that we have to try to just really build trust and get people involved in services across the community.
Yes.
I believe it was Trustee Youngland who said, was asking about burnout, if I'm remembering correctly. So that's kind of where the leadership support would come in. As I mentioned earlier in my presentation, we have built wellness supports all across the state. And have not been able to get that funded here in Larimer County. And so really this is building up all of our coordinators and our leaders. We have a brand new manager. She's phenomenal. I'm excited that you get to have her present to you the next time and that I don't have to do it. But really kind of developing her and developing the team to make sure that we have that sustainable crew who can really be the face of our programming for the people that we're serving, as well as giving them some wellness, making sure that we're continuing the ongoing stakeholder engagement and networking. And Danny, like she mentioned, a lot of her position is wellness. So do you mind elaborating on that?
Yeah, it's really innovative, an exciting opportunity that we've been able to do around the state. We want to bring it here to Larimer County. Is what does it mean if we actually help and provide healthy providers to serve our individuals and participants and clients? So much wonderful things can happen in that space. So that means additional professional development training. It means additional group supervision, individual supervision, consultation, and support. So we're providing best practices and we're making decisions not in isolation so we can stay in the work long-term and retain. It also means additional wellness services such as opportunities to enter into behavioral health counseling, past EAP, and be able to robustly take care of ourselves so we can take good care of our community. And we've been providing this program throughout the state, and we're seeing increased retention. And that's a big thing we want to bring to our Fort Collins team. We want to retain them. We want them to feel supported and seen. So again, we can care deeply for those that we serve.
Absolutely. And so I'll just have you cruise to the next slide real quick. We're shooting for the moon. I'm going to just own it. So for this initial one, for the activities that were funded in year 1 and year 2, we are requesting that addition, that $210,000 so we can maintain the Narcan access, the safe injection equipment access, and linkages to cure and infectious disease. And then the rest of this would be to really build in that program, that clinician, and that team support, so we can ensure that we can sustain services across. Do you have anything else you'd like to say? All right, thank you so much. When you find us, you're really helping expand access to treatment and to alleviate the burdens on different community facilities and community pillars. So thank you very much for hearing us out and letting us wrap around our participants.
Thank you. Thank you. Right, Colorado Health Alliance.
I'm back. I'm back, y'all. All right. All right. I'm assuming you still need me to go fast.
You still have energy.
Always.
10 minutes, really? The whole deal? Okay. I was prepared. I was prepared to run. All right, so again, same kind of outline and structure as the previous presentation. I wanted to just give a summary of the work we've been able to do for the last year and a half as part of our proposal for the coming year as well. And so that'll be the first chunk, working area and proposal, and then scope adjustments and sustainability commentary. So this is, you saw this, let's keep going. Let's get to the fun stuff. We love a graph. So this is a combination of the first year's data and the data you just saw, really summarizing that distribution, the reversal project, education materials, and total naloxone distribution. What I am really excited to show you is, we've got 2023 to 2024 in this purple color, and 24 to date in the blue. And look at purple in comparison to blue last year in comparison to blue. In a lot of ways, we're on track to just demolish the work we did last year and do that more robustly and more intentionally across the community as a result. And so very exciting to be able to present that back to the council, because that is the result of the funds from this group. This is also from last year. We'll get these data at the close of our grant from Butler, but this is from the overdose education pre and post survey assessment that folks take. So before we start a training, we ask folks what they know. And then after a training, we ask them if they know anything else. And so before training competence using naloxone, we haven't learned anything. You can see we have a scale that points down with low confidence and no confidence at the bottom. After training, we have a reverse, which is awesome. So our trainings work. Yeah, let's keep doing it. Accomplishments to date in that care coordination, peer recovery support space. This one's kind of hard to see on the screen, so I apologize. I'll try and summarize for you, but you will see that the 2023 to 24 is this darker blue, which is on the bottom. And then 24 to date is the lighter blue, still dark blue on the screen, on the top. But what you'll notice is that as a result of getting our staff through training and through orientation and in the community, those numbers are at least what they were at the close of the year last year already for this year. And so again, just seeing that once we have our staff trained, equipped, and ready to go into the community, that they're able to execute that work effectively. So peer recovery coaching 2023 versus 24 numbers. This was I think we had 27 across 2023. And again, that 34, 35 out of 2024 for that peer recovery coach training. Again, 2 more to come this year. Rethinking addiction, again, substantially has grown since last year as well. Brought in community support, partnership with the Colorado Attorney General's office certainly bolsters the event this year, and get over 600, which is exciting. Evaluation. We've done some stuff in this space. I say we, but Butler did it. To that end, one of those deliverables from last year was this community assessment. With that, I just want to highlight where the council is really like taking the recommendations and implementing them. That's really refreshing and not something that always happens. So continuing to invest in prevention, treatment, and recovery, harm reduction strategies in particular, and life-saving tools aiming to reduce race-based health disparities, reducing stigma, centering polysubstance use. All of these came out of those recommendations, but additionally, from that year one recommendation, there was that development of data systems and building a data collaborative and really working across sectors to build something. And so from there, we can see year two, we have that working group that has come to fruition and building out those outcomes. Okay, so those were the 4 buckets we used to do. We want to keep doing them. That's the summary. But really, to that end, I want to make sure that we are doing that with a path towards sustainability. We've been very fortunate from the funding with the council to be able to do all of this incredible work and recognize that it is not an unending pot. And so with that, really looking at how can we break funding across different budget areas, what are the areas that we can look at from the previous grant cycle and say this was underspent, this is an area we could have cut or trimmed back. And so to that end, there are budget cuts in all 4 of these areas for our proposal, but we are proposing that under that leadership planning and coordination that we pursue that 525 out of the approved budget. I didn't know how much detail you wanted. So you actually have a full proposal already. And additionally, some summary tables, but since we are short on time, this is the distribution we came to. I will also just identify that the council has been built over time, right? And the way that funds were distributed in the first round are very different than now, which is great. Building the plane as we fly it, as we say, right? To that end, I am curious if the council wants to look at the evaluation budget and say, we want to take that contract out of NCHA's budget. And we are happy to do that. We want what's best for the community, and I don't want to push the council into one camp or the other. But initial conversations, there was a need and we stepped up. And if we're not the right ones, I'm happy to step away.
Thank you, MJ.
Yeah.
Appreciate it.
Yeah.
All right. Abundance Foundation.
All right, I'll try and keep it to 5 minutes, because that's what it's only. For those of you that don't know me, I'm Brian Bauer. I'm the executive director of the Abundance Foundation. We do recovery coaching services and sober living in Larimer County. All right, so here's just a brief overview of some of the programming that we are already doing. One-on-one recovery coaching services for people that are transitioning out of Larimer County Jail, detox, local treatment centers, actually treatment centers from Denver in the Denver metro area as well, that are coming up here to get recovery coaching and sober living. Connection to sober community, that's what the recovery coaching peer services is for. It's connect to the 12-step community, connect to other resources, connect to a lot of the other organizations that are here and get any other services that they're trying to get. So we help them with financial support, budgeting. We've been able to use the grant funding to do scholarshiping for people into our sober living houses. So we offer scholarships that are 50% of rent in the first month, 25 the second, and 25 the third. We've actually been able to use this in combination with support from probation and parole to be able to have probation and parole cover some of the first month as well. And we can get people to 6 or 7 months into their sobriety journey before they're actually paying full rent to be in sober living. Sober living treatment placement. So even if somebody isn't, for whatever reason, a good fit for us, or they want to be living in another location, we do help coordinate through our recovery coaches another opportunity for them to live at a different sober living. Or if they're needing a higher level of care, we've been able to get people into other treatment centers to do like a 30-day treatment, 60-day treatment, and then come back to our sober living once they're a little bit more stabilized. Employment, one cool thing that I've had come up with this is that we've been able to collaborate with an organization called Express Employment in the area. And we plug our clients in with them and they help them in the job search thing and the whole job search realm, mainly to get a job in like a career oriented path. So it's great for people to have a job, whether it's fast food or just temp labor, those type of things. We've actually been able to get them into a process where people can start getting into a line of trade like HVAC, those type of situations. Women's dance, our women's recovery coach team has been able to get into the Larimer County Jail and start a dancer team called Dance to Be Free. And so they go in there once a week on Saturdays and dance with a different group of women. And that's been super impactful with being able to start building those relationships and get those women, the women that are still incarcerated, active. We do the same thing with Title Boxing and Crunch Fitness. The coaches, and a big part of our thing is getting people moving, active, and living a healthy lifestyle again. So boxing, Crunch Fitness, we have a yoga instructor. Equine therapy, we've been able to send 3 groups of people through a equine therapy organization in North Fort Collins. That's a 6-week-long program. That's been super impactful. Life recovery groups at a couple of the local churches. We run our own weekly meeting on Friday evenings at Genesis Project Church. That's open to anybody in recovery. So it doesn't have to be from us. It doesn't have to be from any specific 12-step. Just anybody that's in recovery can join. So we do a weekly dinner and some type of event at those weekly meetings. We've been able to collaborate with CARE, which is Colorado Artists in Recovery. So they come do an activity once a month with us as well. And that is grown to around 70 people every Friday night that we're getting to attend that. We're almost outgrowing the space that the church is giving us to run that. Then our weekly and monthly activities, we always have stuff going on. So that would be way more in detail. What we're looking to expand into is we've been putting together codependency and relationship groups. Relationships are a big aspect that people don't know how to navigate in early recovery. So we have a whole basically 6-week-long program on codependency and relationship groups that we're looking to implement here in the next couple of months. We want to get into DUI relapse prevention groups as well as MRT, SSIC groups, things that are required by Department of Corrections, and start to use the coaches that we have to get their CAT certifications so that they're able to do case management and run these approved groups. A lot of that stuff, when people are coming out, they need to sign up for those groups, and then we have to coordinate with a lot of other organizations to make it happen. It's going to be better if we can start doing that stuff in-house with everything that we're already doing. We have another coach that we're bringing on that does breath work, which has been a different type of therapy that's been really impactful as well. Parental support, mothers and fathers in early recovery. That's something I'm going to be doing too. We have a lot of people that are single mothers. We also have several that are single fathers, and that doesn't get talked about enough, that the single fathers are going to try and get custody back of their kids. And there isn't a lot of support groups for single fathers in recovery. And then figure out what we're going to do with the men's programs inside the jail now that the women are doing dance. That's something that's kind of in the works with that too. Next one. So staff growth, one of the big things that we're trying to focus on is expansion into Loveland. A lot of our stuff is based in Fort Collins. We are involved with people that are in sober livings in Loveland. We're expanding our sober livings to Loveland. And we're really trying to move some of these coaches up, like I was saying, to be able to coordinate on those other types of groups to get their CAT certifications. But in the process of doing that, we need to fill those roles with new recovery coaches. What we've actually done recently is, in addition to the CCAR recovery coaching and the state certified one, we have built our own 6-week-long recovery coaching program so that when somebody is a new recovery coach and they come to work for us, there's additional training that goes into that. That's over 6 weeks. And that's way more in depth when it comes to being a recovery coach and everything that we're doing programming wise, because there's a lot of just autonomy in the way that we run our coaching services. And so without a whole lot of oversight, they need a lot more training on the front end. And so that's what we're working on launching here in the next couple of weeks. So to do that, we just really need to hire a whole new staff this next year to be able to take on the expansion of that. Next one. Yep, so 2 Loveland houses that'll serve 20 to 24 more individuals in housing. We have the potential to possibly have a single moms and kids house in Fort Collins as well. That already exists, but we're kind of in the talks of what that could be like if it shifted over to us. There's a lot of just moving parts on that right now. Next one. We're tracking the data, so we started our own data tracking survey. The big thing that we're trying to come up with is not just that people are sober, housed, and employed, but what's their quality of life like? So we're tracking their quality of life from a baseline, what it's like at 90 days when they do their updated service plans, what it's like at 6 months, what it's like at 1 year, and what it's like at 2 year. So we're able to do that, break it down into demographics, individuals totally in the program, full-time employment, self-sufficient housing, and then their quality of life standards. So how do they feel about their outlook on the future? What do their support systems look like? What's their connection to their own spirituality or religious beliefs at those different points in time? We want to be able to track how well their life is going, and not just like, because people can be sober in their life and still be miserable a year into their sobriety. We want people to have a fully self-sufficient life, and they want them to be back to contributing members of society and be happy with where they're at. And so that's our ultimate goal. And we're actually able to start tracking that data as it is now. Next one. This is what I found is the basic cost. So over every 90-day period, it's $500 per client over that 90-day period for all the services that we do. And that includes the people that are in our housing and whatnot. Any other 90-day programs are between $12,000 and $16,000 on average for that. I didn't get the slide in here, I guess, for what the ask is. I believe if I was talking to the grant funders, I believe that we're shooting for $225,000. Yes.
Thank you.
That's the end of my 5.
Appreciate it. Great. All right, Paul, recognition.
Hello again. Hey, I don't have slides. I'm gonna talk slow. I'm gonna give you just a couple of numbers and I'm gonna wrap up before 5 minutes, okay? So Harvest Farm and Fort Collins Rescue Mission are sister organizations here in Northern Colorado, run by Denver Rescue Mission. Harvest Farm, just this last fiscal year has had more graduates than it's ever had in its 33 years of operation. The most we had was, I think, in 2019, and that was 57 graduates out of a 72-bed program. And this last year, we got up to 66 graduates. Next year, we're planning on having about 70 to 80 graduates. And so we're really honing in on the recovery program that's free for people to come into, and focusing also on outcomes and not outputs. And so we could talk about how many meals or bed nights we serve, but really the point of Harvest Farm is that men are returning to their families, whether that's a husband who's restored to his wife, or a dad to his children, or a brother to their sister, or a son to the mother and father. And to graduate Harvest Farm, you need to have your sobriety intact. You need a secure place to live. You need income. Most of the time that's employment to support your livelihood. Sometimes it's Social Security, SSDI or SSI. And you need healthy community. So all 66 of those men who graduate from Harvest Farm have those 4 things. And we've also tracked a year. We haven't tracked those 66 because they haven't been out for a year. But our most recent 1-year graduation post-grad rates for housing is above 80%. And so a year after graduating, we're seeing that the program and really the community and all the other factors that really make people successful, which isn't just farm, has led to long-term success. So that's all Harvest Farm, and I say that in order to introduce my next very relevant topic, and that is the ROAC supported us for Fort Collins Rescue Mission to continue to serve our guests experiencing homelessness 24 hours a day, 7 days a week. Now that's incredibly important in order for people experiencing homelessness to access case management and recovery groups, all the other things that help relieve them of homelessness. And since being funded, we improved on our referral rate from Fort Collins Rescue Mission to Harvest Farm. That was about 20%, and we've gotten that up to half of our referrals to Harvest Farm. And what this means is that people who are actively homeless on the streets of Fort Collins are coming into Fort Collins Rescue Mission and addressing their substance use disorder by getting into Harvest Farm, and then letting Harvest Farm do the work to build the success and stability into their families and housing of their own. And so with Harvest Farm and Fort Collins Rescue Mission together combined, we're reaching out to those people who have the very least hope and the very least resources. And we're bringing them into a program that fits for them. Not everyone's a fit for Harvest Farm, and some people actively resolve their homelessness at Fort Collins Rescue Mission. In fact, 75 people actively resolved their homelessness and exited homelessness from Fort Collins Rescue Mission last year. So we're simply asking that you continue your support so that we can change our intake specialist into a full-time role. We can keep our 24/7 sheltering going. And we have a case manager who is also supported by the ROAC to bring those men out of homelessness into recovery and ultimately into housing and a whole life. I think our award for social connectivity last year was $244,000. I think we took away a couple of $1,000 just because that's what the bucket presented. And so our presentation is for $247,000 for 4 roles. An intake manager that will do intake at Fort Collins Rescue Mission and Harvest Farm, a case manager, and 2 shelter workers to keep our shelter going 24/7. Thank you.
Thank you, Scott. All right, Darrell, like.
Alrighty, the last presentation. Let's do this. My name is Lucrecia. I use she, her, and ella pronouns, and I'm the Harm Reduction and BIPOC Program Director at the Yarrow Collective.
I'm Gina Rupp. I use she, her pronouns, and I am the Administrative Director for the Yarrow Collective as well as peer support facilitator.
And most of you know who we are, but we recently had a retreat where we edited into a Dear Mission, and so we're going to share it with you all because we really love it. We're excited. So Yarrow Collective is a by-4 with lived experience organization that builds peer support, recovery, and harm reduction spaces, tools, and training. So together as a community, we can allow space for mental distress, awaken to the wisdom of our lived experiences, aspire towards healing justice, amplify our voices, and advocate for non-carceral consent-based alternatives. And what do we mean when we use the word peers? When we say peer, we're referring to a relationship built on shared lived experience. Peer support is something we consistently practice through mutuality and cultivating transformative relationships together. Yarrow Collective engages peer support relationships by or with people who have lived experience with psychiatric diagnosis, trauma, extreme states, houselessness, disabilities or chronic illness, problems with substances, incarceration, criminalizations, and other life-interrupting challenges. That is a mouthful, but.
I say, and we really like to focus on this specifically because at the Yarrow Collective, we really focus on peer support and being peer supporters instead of recovery coaches specifically. We focus a lot on the mental health and the, social justice issues and things like that that really surround our folks with substance use disorders, misuse, all of those types of things.
So harm reduction peer support, that's a beautiful quote by Lola Watson. But beyond a set of public health interventions, such as like risk reduction, like Narcan syringe exchange, harm reduction is a life philosophy that includes the radical act of centering our humanity with compassionate witnessing, non-judgment, genuine connection, and authentic relationships. That's really what our harm reduction work is built on, and really the foundational structure of how we show up with harm reduction. Our current harm reduction groups, we have a mobile harm reduction group, bi-weekly in Fort Collins, Risk Less Livermore, which is housed at Murphy Center. Saving Ourselves for people of color, and Noose, we have two new site groups at the jail, one for men and one for women, at Tulare County Jail. Our current harm reduction peer support groups, we've had 964 drop-ins among 466 non-duplicated individuals. We've distributed 402 naloxone kits and over 1,000 fentanyl testing strips. And the participant impact, we've reduced isolation and loneliness, increased knowledge about harm reduction tools, and increased sense of community. Next slide. And our jail-based peer support, that is Kyle, our reentry navigator at Overdose Awareness Day. So our jail and reentry peers have provided 105 peer support sessions to 55 individuals incarcerated or exiting incarceration over 12 months. And we currently did our first intentional peer support training in the Larimer County Jail, where we were able to train 8 inmates in intentional peer support. That training, it was a 4-day training, Monday to Friday. There was so many like beautiful connections and relationships that were built, and the final graduation they presented, and that presentation was so beautiful. If you guys are interested in seeing it, let me know. It was really, really fun. And to continue to go into the jail weekly and provide core reflection to support the peers that are currently in the Larimer County Jail.
And I'll add in here too that that number is not any of our like peer support groups for new site that we go into. These are like individual one-on-one peer support sessions. And then out of the 8 inmates that we trained in intentional peer support, several are still involved. Some are out in the community now, still doing peer support and really engaged in our community, as well as I know of at least 2 that are still currently incarcerated that are giving peer support to other inmates inside. So for our ongoing program needs, and this is actually very different than the funding that we currently have from y'all. We currently have funding surrounding like social activities out in the community. And so none of that has been talked about here, but we will be coming back to do our 6-month report. But we kind of looked at the funding recommendations and like the suggestions and saw that there was a real need for one-on-one peer support. So we have participants consistently, every group that we have, every community event that we have are asking for more one-on-one peer support in between our scheduled weekly groups. And so we really want to focus on that. And then space and coordination. We currently operate out of several different areas, depending on the population that we're serving. It's important that we're kind of in these different areas, but having like a space where we can make sure that everybody feels comfortable and warm, that they can go to is definitely in our immediate future, so. Our primary objectives would just be to expand that one-on-one peer support. As we said, we already have one person, Kyle, who is like our reentry peer. Lucrecia, myself, and Ashley also do one-on-one peer support in the jail. Currently, there is an intense wait list for one-on-one peer support. And so we would love to get a full-time person possibly embedded in the jail. We're unsure how that will look. And then we also are doing work completely different with young mothers and pregnant mothers currently through the Larimer County Community Catalyst or SPARK program. And so there is an intense wait list for one-on-one peer support for those folks as well. And so we're ready to expand those services as soon as possible. And then really just another peer support one-on-one person to give harm reduction peer support out here in the community. So what that looks like is 80 hours to increase those peer support positions to full-times for the jail and for the young mothers. And then 25 hours per week for the person out in the community. We do have like some matched funding for that to make that a full-time position. And then that dedicated space, or our total request is about 312.
And I'll just talk really to like the importance of having like a space, like that third space is really important for the community to have like the space outside of home and work. A space to come to and just really be held. So I just wanted to add that because it's super important. And see.
Thank you. Appreciate it. All right, council, that concludes our presentation. Let's give a round of applause to all of you. Thank you for all that. What we'll do is get all that information for the tabulator for everyone. So when we move to our next meetings, you have all that in front of you, and then we can ask questions and so forth. Yes.
I thought we were, going to ask some questions inside the spreadsheet so that they could get back to the.
Sure.
To the.
Yeah.
Presentations from today. I didn't, and I don't, because we're not having them all come back to ask
No,
questions.
I'm sorry. Thanks for the clarification.
So I was like, oh, okay. So I was wondering and hoping that, because there's a lot of information, I'm trying to listen and type in, and I also want to go back and look. Could we keep this open, to the council just for, 30s, tomorrow night? To just finish up, just to help you
Yeah.
tabulate, so.
I
So
think
that gives enough time for the, for you to get the questions out to the presenters, and I just don't want that. Hold me accountable to just get right back to it when my brain's fresh and not drag it out, so I was hoping that maybe we could, if the council would be okay with us keeping that up until, tomorrow night at midnight, should we say, because I'm up till midnight working for me, so does that work? Well, then work, it's fine. Well, I'm thinking if it's over the weekend, I mean, I guess it is Friday, but I'm just thinking it's, but you get further away from the presentations, it starts to.
What I'm hearing, and Liv's okay with that we'll have the spreadsheet still going till tomorrow midnight. It's questions, if you had it written down or you didn't get it, I got a half typed question in here that didn't make much sense, so I'll get my thoughts together. So thank you for that wonderful thought and idea, and we'll do that so we can get all our questions to the grantees. Again, next month, we'll start it off with the 5 organizations that have not been part of the grantee system. So we'll get there. And then after that, that's when we'll start having the conversation, deliberation, and have to make some decisions. So wonderful. Okay. Next item on the agenda is EPI Working Group Survey. And I'll turn that over to our vice chair.
Yes, we have been working on that. We had asked about doing that survey and getting that question answered, and we cited was not enough time. We did not have proper notice for getting that question out to the grantees, and that's really important for this EPI group. I know Dr. Olson has been trying to reach out individually, but we thought if we had a question coming from the rollout to show that this is not just coming from Butler and from this subgroup, but actually coming from the council, that we're asking them to participate. And it's not to show that we really want to hear from them. This is not going to be held against them or something that we're looking like, oh, they complain about this or that, or maybe they have this, but we really want to work with them to try to develop this tool. And so we need their participation, and we haven't had a lot of participation. So we wanted to vote for my suggestion, and we had talked about this in the EPI group, is to send out an email or to them all, like a kind of mini letter from us, just saying this is really, we really want engagement. This is helping us craft a better tool or a better feedback, so we can, because they're the ones going through it, and we're what we want to see, but also how it works for them. And so I just was looking for a motion to approve, send that out from the council to request them to participate with this survey with Dr. Olson. And you, Dr. Olson, did I cover that?
That sounds great.
Does that, did you, I know you've been contacted, but we wanted to show that the council is.
I think that works as well. I've had conversations with almost all the grantees, right? Still a relatively small number. So I think we're moving in the right direction. Doesn't hurt to be able to send out an email from the council as well.
And we would have done it last meeting, which would have been more timely, but which would have helped with conversations, but we had to delay this vote. So if we could, I'd just like to and I would just give Dr. Maybe you and I could send it, both of us, and have something.
Whatever everything works for us.
I make that motion.
I'll second.
We've got a motion and a second. Any further conversation to make sure I'm keeping those online? Okay, not seeing any. Does anybody oppose that motion? Not hearing any, that passes unanimously. We'll get that out ASAP.
I asked Dr. Elton to help us craft that, and then we'll sign off.
Yep, we can use
Oh,
this
this
or a
one?
version of
Okay.
this, but I'm also happy to make it, but this was included in the packet as.
Oh, you're right, I read that. That didn't make that connection, so
No
I'm glad.
worries.
Thank
There's a
you.
lot in the packet.
There was a lot of packets.
100,000 pages in there. Seemed like, didn't it? All right, moving on, number 7. Liv, you're doing great job being forward thinking, goes Tom. November and December meetings are right on holidays that are, November, December. So we started going, oh boy, I don't know if everybody wants to show up on Thanksgiving or, but I know we're dedicated, but the thought was we combine those just because the holiday season and people gone, and do one big meeting on December 5th from 2 to 4. That we've got that in the packet. We want to see if that works for everyone. We were just trying to find a date that will get us. Smart. Questions, comments, concerns with that date? Yes, Beth.
I think the date's good. I'm just curious if we think 2 hours is enough, looking at things we need to do in November.
It might not be, or unless we got everybody doing 2-minute things.
Maybe we do,
We could do 1 to 4 or 1:30 to 4, or what ideas you have?
Well, yeah, I could do that, or we could at least hold like a 1 to 4, and then if we don't end up with more, you can't.
I'm tied up till 1:30 with something that's already a staff related
Sure.
thing, so we,
About 2 to 5.
2 to 5?
I'm out that day, but there's too many schedules, so if that's the date, that's
2 to
fine.
5, I can
Thank
make
you.
it in there now.
And then perhaps we could shorten it. I think it's probably easier to hold that.
It is,
our
it
challenge.
is.
And if we don't end up with more, because I know we already have 2 6-month reports, the financial report and, well, actually, that's no, but then just said we have another 2 6-month reports. And then if we have in grant, I guess that's gonna be in October. Anyway, yeah.
I like your idea.
Yeah.
Is everybody else, on those online? Any concerns with 2 to 5, just getting it marked on the calendar?
So to clarify, you 2 to 5 on the 5th of December and not have a meeting in November. Is that correct?
Correct.
That's fine with me.
I only request to stay for 3 hours can be hard, so we need the agenda. Maybe give us a
break?
A 10-minute break or 5.
I think that'd be very good, because I don't know if I go 3 hours.
Yeah, it's okay. This is our first one, yeah. So I can put in a break and all that
Yes,
stuff.
10-minute break, sure. We'll make a motion on that.
I'll make the motion that we combine November and December meetings into one meeting on December 5th from 2 p.m. to 5 p.m.
I'll second that.
Got a motion and a second regarding December 5th, 2 to 5 p.m. meeting. Any further conversation? Hearing none, anybody oppose that? Hearing none, that passes unanimously. Oh goodness, look at this. We're to the number 8 of the meeting, adjournment.
I just like to add one piece of information.
Sure.
So, looking forward to seeing you all next week on Monday and Tuesday. This came so fast, but, I wanted to just share, that, Lerma County gives out innovation awards to employee groups. And we had, some amazing groups, including how we recycle mattresses at the landfill and help people down. But one of the grand prize winner was, Deputy Brendan Solano,
Yes.
from the co-responder program that's inside the youth council school district, and the work that he's done. And I've been trying to get the video because it's not on the website like I thought it would be. And so I was just want to let you know it's going to pass. send it to Lynn after and send it out to you, because you can hear from the teachers and some of the feedback, and it's a really wonderful video. Of course, you can tell deputies don't like to be filmed, but they did a great job. They did a really great job, and it's really well done, and I just wanted to let you all know, that's a really tough innovation award to win. There's a lot of people, and it's just wanted to share that and really want to congratulate them, and thanks again, happy co-responder weekend. I just wanted to let you know I was going to see about sending that out, because they have done tremendous work, and I think saved lives there as well. So
Good stuff, great work, innovation, we love it. Anybody want a motion? Well, we keep meeting.
Can I add something?
You bet.
September, I mean, it's recovery month. Thank everyone on this council for the work they're doing, helping individuals struggling with substance use disorder find recovery. I want to thank all of our grantees for the incredible work you guys are all doing in our community, saving lives, improving lives, and improving the health of our entire community. Thank you.
Thank you, Shane, for that. That's great.
I'll just echo that, because first of all, thank you for bringing it up, and I want to echo it and just say these presentations were really amazing today. And I mean, I read through the stuff, but seeing and hearing you all was really, really, really great. So thank you so much for all the work you're doing.
it's also suicide prevention month.
Yes.
I think this is all connected
It
and
is.
tied in. I lost, my friend lost her son last week. That my kids went to school with, so I just want to say, and we have some things that this is just ongoing, and just a lot of things happening, and so I think we're all here for a reason and doing this work and dedicated to it, and we're here because we care, we want to make a difference, and we appreciate everyone's work. This has been a lot of hard work, but we've really stayed focused, and I appreciate each and every one of you, all of you behind us, because we are making an impact. We're certainly turning some heads, and what are they doing up there? But the most important thing is that we're saving lives and transforming lives. You all are part of that. So thank you for being the Lerner team. Thanks.
You know, and Dr. Jared Olson's got a lot of data is showing a downward trend, definitely for suicides, down 28% in 2019, but also overdose deaths.
Yeah.
And Larimer County is leading the way in much of these data sets. Am I correct, Jared?
And certainly for suicide and then where the overdose trend is near state level at least.
Now our goal is certainly zero of all this stuff, and we're going to continue to work, but there is some good signs, and that's the good work here. All right, anything else?
Motion to adjourn.
Second.
Got a motion and second. All those in favor of adjourning the meeting, say aye.
Hi.
All right, we're adjourned. Our next meeting is October 24th from 2 to 4. We look forward to hearing some more presentations from our organizations doing great work in the community. Thank you.
All right, I got it. I want to get some.
Yeah.